Hello and welcome to DrugsPlus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so that I'm able to continue creating this content. In this video, I'm going to discuss tau therapies for the prevention and treatment of Alzheimer's disease. For a more detailed introduction to Alzheimer's disease, you can see my introduction video, which I'll provide the link for below. The brains of patients with Alzheimer's disease feature significant shrinkage of the cerebral cortex, enlarged ventricles, and a shrinking of the hippocampus. This commonly presents as memory loss as well as communication, movement, and personality changes. Now, just a quick reminder of the second part of the amyloid hypothesis. Amyloid plaques promote the entrance of GSK3 kinase enzymes into nearby neurons. So, if we zoom into the neuron, you can see the microtubules inside. Microtubules are responsible for the transport of material inside the cell. Tau is a microtubule binding protein which helps maintain the stability. However, the GSK3 enzymes that were recruited by the amyloid beta plaques phosphorylate the tau proteins. This induces a conformational change and they can no longer bind to the microtubules. This means the microtubules will lose their stability and perhaps their function. The lost tau aggregates and forms a neurofibrillary tau tangle, a hallmark of Alzheimer's disease and a promising target for new Alzheimer's drugs. For example, GSK3 inhibitors are in development. These drugs inhibit GSK3, preventing the phosphorylation of tau proteins, meaning they cannot aggregate. One such drug, tidagliflozin, was being developed but showed no improvement in cognition. Lithium, however, is a much more promising candidate and clinical trials are expected shortly. Also in development are tau aggregation inhibitors. Tau is a polar protein, meaning its charge is unevenly distributed. This property is perfect for aggregation as the positive moieties are attracted to the negative moieties of adjacent tau proteins, and vice versa. For this reason, tau aggregation inhibitors remove their polar property, meaning tau can no longer aggregate. One such drug, methylene blue, showed a significant decrease in tau aggregation, but didn't produce any reduction in cognitive decline. Curcumin also had no effect on cognition. Another potential method of preventing the formation of tau tangles is by using the immune system. Tau vaccines allow the body to create specific antibodies for tau, so when tangles do form in the brain, they can be targeted to the microglia for clearance. One potential tau vaccine is AAD-VAC1, which is currently in development. Tau antibodies themselves are also in development for Alzheimer's disease, for example RG7345. Thank you for watching this video. If you found it useful, please give it a thumbs up and subscribe to support this channel so I'm able to keep creating this content. I'll be back with more pharmacology videos soon.